Hello, welcome to From the Hill Zoom version. I'm State Representative Jim Arciero, and since the pandemic, this is about looking at week 8. I've been having weekly discussions with folks who are on the front lines, people in the field, fighting this invisible enemy. And one of the individuals I have today has been a great friend to this district, this community, this region, is CEO of Lowell General Hospital and President Jody White. Jody, thank you for being here today.
Jim, thanks for the opportunity. I always look forward to chatting with you.
I appreciate it. And right around the time, about 8 weeks ago, like I said, Lowell General started having a weekly conference call with legislators in Greater Lowell in this region. And it's been tremendously helpful. Lowell General and Emerson for Westford, for Littleton and Chelmsford are the most, I would say, widely used hospitals and healthcare facilities in the region. We have Circle Health has an outpatient service here on 110 in Westford, which myself, my wife, so many individuals in the area use. And Jody, just sort of take us through your perspective from Lowell General, from Circle Health, since this pandemic broke. And I know we started, I think it was the first conference call with legislators was an extensive one. It was a scary one. There's a lot of details. We say as sort of as legislators and others, we've been drinking from a fire hose with the information, and it changes so quickly. So your perspective on Lowell General Hospital and Circle Health and where we are now and where the journey's been the last 8 weeks.
Do we have 4 hours for this for this conversation? Let me put it into some chunks for you, Representative. Thank you. Again, thank you for your leadership and your great work. I love getting on the phone with you guys and updating. We always have great questions. And when we disengage, I am so confident that you've got the info that you need to be effective for the folks that put you into office and to get them great information. So thanks for being a good friend and thanks for being a great ally with us. I appreciate it. It goes back to the top of March when all of a sudden this thing called coronavirus, COVID, hits and away we go. And we were asked as an industry by the governor to basically prepare. And that was two big things. And that was to stop doing things that weren't emergent. So taking all of our elective business and stopping it immediately, preserving our staff, preserving our personal protective equipment, our PPE, and building capacity. So within like 2 days, we dropped 40% of our business and basically put our entire business on hold. As you know, Circle's a big company. We're almost $600 million in business. We've got 4,000 employees. We're more like a regional medical center in the scope and breadth of our business. But since the top of March, with stopping all of our elective business, we've really gone into a command center mode. Amy Hoey, who's my Executive Vice President, Chief Operating Officer, is amazing. She's the incident commander for Circle Health, and we have incident command meetings every morning at 9 o'clock, seeing what we're doing, interacting with our team. As you know, I'm the chair of the Massachusetts Health and Hospital Association this year. Heck of a year to be chair, working with Steve Walsh and the incredible team at MHA, and I get the good fortune of being on with the secretary and others and helping to figure out what's happening across the Commonwealth. But for Circle, it's been going in incident command mode. We've really surged in areas that we've needed to because, as you understand from this virus, people get very sick quickly, and across the Commonwealth, most hospitals are surging in their ICU capacity. I can just give you a couple of quick examples. So for Circle, for example, we generally have 23 ICU beds in our two units in the main campus. Today, we've got, let's just see, we've got 50 ICU beds running today. We've got 20 COVID positive patients in our ICU today. We've got 23 people on ventilators today. Our normal ventilator census is 5, 6, 7, 8, 9. We've had as high as 30 people on life-saving ventilator equipment. And we had on our call this morning, we had our 30th person taken off of was extubated, coming off the vent, which is just a huge home run for us. And we play a musical thing, Fanfare for the Common Man overhead whenever a life is saved and a patient goes home. So we're a very different business right now. We are still in a very slow ramp up to get people back to the hospital. I can talk more about that as we go, but we've learned a lot of things. We're a very different hospital. But we've been focused on our mission, which is put patients first and deliver on our promise of complete connected care.
Yeah, I noticed probably every conference call we have, one of the first things we talk about is, Jody, how you doing with PPEs? How you doing with equipment? How you doing with staffing? And moving forward, are we going to be able to continue to handle things, with the appropriate amount of staff and equipment? So how are you feeling now?
Feeling really good about the number of staff that we have. When we open up our incident command meetings, it always talks about that this is a team sport. And folks that used to do one job have now been reassigned to do other jobs. Folks that used to do work that we're not doing anymore are now coming out and being greeters and handing out masks and making sure the hand sanitation works. Folks that were used to work in the operating rooms are now helping support our intensive care patients. So people are stepping up in a big way. Our medical staff is nothing short of amazing. How the critical care doctors, the infectious disease doctors, the cardiologists are all jumping into play to take great care of patients, and it really is something to watch. As you know, we're a member of WellForce. That's our parent company with Tufts Medical Center and Melrose Wakefield and the Home Health Foundation. So sourcing personal protective equipment against a much larger company has been a big benefit to us, and hats off to our team at WellForce that are doing just a great job supporting us. And then we've had companies in our community that have just helped a lot, like Zoll Medical in Chelmsford has given us ventilators where they were coming in short supply, and they really didn't have to because they had all their ventilators scooped up into the federal stockpile, but they sent us pallets of ventilators just as one phone call to say, with a note saying, this is where my employees live and work and where we get our health care. We're standing with you. So I can give you a million stories like that would just make you smile and say, wow, this is an amazing place to work and to live. So we're doing great. It's not without struggles. Who knows where the PPE is going to go next? I hope our supply chain in the US learns a lesson that we can't be so dependent on foreign supply chains for PPE. I hope the same thing happens with antibiotics, where we've got a huge foreign dependency. We don't make any more antibiotics in the US. We've got to look for ways to get better at that. But I appreciate the ask, and the team is doing, they're tired. Folks are continue to be stressed. I would be lying if I said everybody is wonderful and great. This is hard work. We are in a fight right now. But Lowell General has fighters, and they're stepping up every day.
Do you feel that there's, regionally, of course, Circle Health is a pretty good reach in the area, et cetera. Is there, portions of the city of Lowell that have been hit a little bit harder, or portions of some of the suburbs you're seeing, or for the most part, has it just been, you're playing the percentages of the areas in Middlesex County, which are higher? It's a bigger county than other places, through the Commonwealth. Just your perspective on that. Have you seen that at all?
Jim, you're spot on. I think the virus is very predictable in one way, in that it affects those that are in more densely populated areas more than it affects those that are not. The reason why the nursing homes and other congregate housing has had a higher degree of penetration is because folks are just very, very close together. It's why when the governor comes on and says the three things we've got to continue to do, no matter what he announces, either later today or maybe Monday, we're going to have to continue the social distance through the summer for sure. We're going to have to wear masks through the summer for sure. And we are going to have to be sure that we are really watching where our hands are going. They have to have great hand hygiene, stop touching your face, and just do those common sense things. And we really will be able to keep it somewhat under control. So Lowell has been a hot spot. You look at the numbers across the Merrimack Valley, certainly the Lowell Lawrence market has a lot more viral load, we'll say, than perhaps others. I think it's just simply because of the density of our population and the fact that, we have 100,000 people living in Lowell. And you look at New York City, you look at other densely populated places, it tends to be a little bit heavier. So, but we haven't seen much across either ethnicity or other ways to sort out the population. And a big shout out to the Lowell Community Health Center. Just an amazing, amazing organization that has just jumped into action. And they are, Sue West-Levine is nothing short of amazing. She's doing a great job.
Now, Jody, I come from a medical family myself. My wife's a nurse. My mom was a nurse. My brother's a surgical oncologist, and my brother-in-law is a gastroenterologist. But just like you said, a few minutes ago, it's all hands on deck. And my brother came on a Zoom show, probably like my second or third show. And he was talking from his perspective about being a surgical oncologist, and there were still some elected surgeries that were kind of tweenering on elective, not elected. If you wait too long, they're not elective anymore. Did you see a little bit of that, or?
Oh yeah. So, you come in the top of March, and when the governor's mandate is all hands on deck, and we just stopped doing things that we didn't see as emergent, that was a lot of stuff, a lot of things that we were hoping, we didn't know how long this was going to go on for. You fast forward to today, if you look at our surgical schedule inside Lowell General, it's creeping up because what was really not emergent then is now certainly becoming more urgent and emergent now. Talking to our friends at Tufts who have a little bit more of an arm into the research side of things, you look across the Commonwealth, the incidence of stroke coming into hospitals is down 40%. The incidence of heart attacks coming into hospitals is down like 25 or 30%. That's not because the disease isn't there. Nothing has changed there. It's just simply that folks who would have come in sooner aren't coming in because, number one, we've told them they shouldn't. And number two, they're afraid, and folks don't want to come anywhere near a hospital. So we've got a whole big campaign that's going to start up about Safe With Us. You would not believe the efforts that the hospitals across the entire Commonwealth, Lowell General included, Emerson included, Lawrence General, Holy Family included. These are very safe places. One thing we've learned is how to handle this business and how to keep people safe. So you'll see an awful lot of us and our calls, Jim, when we talk to your counterparts in the other communities. I'm going to be leaning hard on, let's get the word out that if you need a radiology test, come and get it. You need your breast biopsy done, come and get it. We're going to be setting things up so people can get back. It won't be a full open for a while, but we are very eager to welcome folks back in as we start our reactivation phase.
This last weeks have been trying for so many people, at home with their children, people certainly, laid off, looking for resources for either small businesses or LLCs or unemployment. Have you seen a ramp up in, or do you see the statistics on ramp ups of, mental illness issues or any mental health issues?
I've not seen any specific data that would say mental health is on the rise. I guess I think you're spot on anecdotally. Being quarantined for 50 days is going to drive anybody crazy. Yeah. But at the same time, we've not seen anything of a major uptick inside circle of major increases in behavioral health. That being said, pandemics, as we're continue to be in the treatment mode now, as we start getting on the other side of this, trying to heal, we're going to find a lot of folks that were banged up pretty badly by this and need some support.
One of the things, Jody, that I always get questioned, and of course, I don't really have a good enough answer, but one thing I do is I pay attention to Governor Cuomo's press conferences. I watch his press conferences every day. There's a lot of parallels, a lot of things going on in New York that obviously have happened in Massachusetts and New Jersey, some of the three hardest hit areas in the country right now. But one of the things that Governor Cuomo talks about is people always ask him and ask his administration, when will this be over? And we always hear, of course, oh, it's a neo-normal. We're going to be moving forward with, social distancing, having a mask in hand. You talked about this in our conference call last week. You said, guys, moving forward for the next year and a half. I mean, we hear 12 to 18 months is when a vaccine could actually be ready in terms of passing FDA regulations and being able to be administered. And we don't even know if that would be administered, locally or to larger groups of people. But what's your perspective on that? Because I feel like that is the biggest anxiety, is when can we actually sort of live our lives the way we used to? What's your answer to that?
Yeah, that's a big one. Again, let's do this for an hour.
I know.
So let's play it this way. I was looking at the state numbers just this morning about new cases, and they're starting to plateau off. They're leveling off. 1,000 new cases a day, whatever it might be. There's going to be a plateauing off. What we've avoided is the spike. We avoided this cataclysmic jump because we social distanced, we wore masks, good hand hygiene, and it spread the curve a bit. So instead of being like this, the curve flattened a bit. That being said, there's lots of virus out there, and we don't know if it's going to, like the influenza virus does, it tends to slack off in the summer and comes back on in the fall. Whether it's warmer weather or sunlight, I'm not quite sure. But so we're also watching, will there be a rebound of some sort come into the fall? We're not sure. I think the best that I can say is a vaccine is going to be a ways off. I thought I heard a statistic that the fastest they've done a vaccine up till now was a couple, 3 years. So I know that the president is focused on trying to do this way, way, way quicker, and maybe they will. But that'll be the real, I'm going to say, the turning point. Up until then, because this is a new virus to the population, we've got some ideas where it's going to go. We know what we can do to control the spread of it. So I think that at least through summer, coming into fall, all of the restrictions that we have now, they may get loosened a little bit. For example, I heard some golf courses are opening. That's not a bad idea. If you can send people out into hundreds of acres, they can stay 6 feet apart and not touch each other. That's a great idea. Should the
Let's
parks
just
be
say,
open?
Jody, if they didn't open, we were going to have a mutiny with people with armed guns and masks coming to the State House soon, because I'm just saying.
Just saying. I think you'll see the parks opening. I think you'll see other things opening. But it's all going to get back to, can you trust the general public not to do what they did in Florida when the governor opened up the beaches and it was spring break all over again, and he had to take them all down again because people were just not behaving well and not using their brains. So I think if people can get used to wearing a mask, and we have to get used to wearing a mask when we're out in public. If people get used to not gathering in large groups, and that's going to be hard, especially in the restaurant business, the bar business, where we're used to getting together. It's part of the deal. I think at least through summer into fall, it's going to be much more gated. And if we can be very good about hand hygiene and keeping our services clean, I think we'll have a way to take this thing down. But it's not going to come down fast, and the disease and the virus is not going away. We're going to be dealing with this, I believe, just like we do with the flu. It's another virus. And whether we will get a vaccine for it, it's going to come back every year, we don't know. It's going to take a few years to sort that out.
Now, Governor Baker announced yesterday, and a few statistics I had written down, that currently we're looking at a little over 9,000 tests per day that are happening right now, and there's a few more regional testing areas that they're going to be opening across the state. I know the one in Lowell has been busy; it's been active, but the governor is looking towards 45,000 tests a day by July, and an ambitious plan of 70,000 by the end of December, 75,000. So do you see moving forward, it's really going to be testing, contact tracing, and quarantining, and trying to really freeze out those areas so they don't spread? Is that really going to be the formula moving forward, Jody, you say? Yeah.
Testing is going to be huge. And I think as a country, we were slow at getting out of the blocks on testing. But the industry is maturing, more tests are available. I think the governor's numbers are aspirational, but we can do it if we put our minds to it and get moving. So I think that the more tests will help us to figure out just where this virus is and how to continue to contend with it. There'll be antibody testing coming out, but they're still trying to figure out the right way to do that. This is not easy stuff. Technically, if you show you've got antibodies, that usually equals immunity. At least for the year, but we don't know the titers yet. So there's all kinds of things that have to get sorted out there. And remember, testing is also a moment in time. So if you and I got tested today, and the results come back tomorrow negative, but today you went out to the concert or you went to the beach and you bumped into a bunch of knuckleheads and nobody's wearing masks, and you get it right then and there. So testing gives you a point in time. It gives you a denominator for where things are across the spectrum. We need more of it. We need tracings. We need where things are going. But the real deal is going to be get to a vaccination.
Yeah, the contact tracing has been very ambitious. There's over 1,000 individuals that are hired on to make these calls, but they've had difficulty with people answering the phone, regardless if it I think the actual caller ID is saying like COVID-19 on it, and so
I think it's Partners in Care. I think is what it's called, Jim. Partners in Care.
Yeah. There's the actual thing that comes up, I guess.
Oh, really?
This is, I think it's Partners in Care. You're correct, but COVID-19. But it's
hang up.
Yeah. No. Well, it's but Jody, I mean, in 2 months time, our world is upside down. It's completely different than the legislature. We've had two virtual sessions where we had to get necessary pieces of legislation move forward on a bond bill, on moving the tax date to July 15th. But it's going to be difficult moving forward for us to even do our job, to be able to actually debate the issues and certainly to change things moving forward, because it's such an ever-changing time and things are going to have to switch again. But we've all had to do this differently. We've had to do remote meetings, whether it's Zoom or conference calls, etc. And so far we've been able to adapt pretty quickly with a lot of information, a lot of changing times. So is there anything you'd like to say to the audience at home? We're kind of getting close to wrapping up soon. I really appreciate you coming out. I really appreciate you as a great partner in this area, fighting this invisible enemy, keeping the legislators informed of what we need to do, either working to acquire additional PPEs or equipment and hospital beds, etc. Any messages to people back home?
Yeah, a couple of things. You mentioned what is the new normal, and I'm a glass half full kind of guy, so I'm looking at what are the things that we've learned through this that are really going to be game changing for us for the positive. I'll just use the example of telehealth. Now, you're experiencing the legislature where you're going to be voting remotely, and you don't have to go in, and that whole industry, I think, is going to transform itself. I've talked to a few friends of mine who are either primary care doctors or surgeons, and out of necessity, the adoption inside Circle for telehealth in the clinical world was at like 17 or 18% before the top of March, is now at almost 89, 90% adoption across our care continuum, and patients love it. And physicians love it. And they're not wasting time coming into the waiting room, filling out the pads, sitting in the chair, going inside, they're finding, almost 90% of what they need to do for routine stuff, they can do via a telehealth call. So I think you're going to see a lot of good things coming out of that. I think you're going to find us behaving in healthcare the same way. What I'd ask for is some patience as we try to make sure that folks know that you are safe with us. And you're going to hear us talking about that a lot. And the other thing you're going to hear us saying that we really are the experts in this, and we know how to move people around and how to get care out. So don't be afraid. Talk to your doctor. We're going to provide you very easy, measured, but very predictable, and I think very helpful ways to re-engage with care. I think the virus has scared everybody. It's put everybody into their homes. It's told you not to touch anything, stay away from hospitals, stay away from people. But I think we're going to find, we look back, that has been detrimental to health, and people need to seek care. We're running ads now in the paper. If you're having chest pain, if you feel numb or weak, or you're feeling like you're not well, don't sit back and say, well, I can't go anywhere because of the virus. That should be categorically not true. You are safe with us. We are the experts. We know your doctor, we know you, and we are here to take care of you. So work with us over summer as we re-engage and get back to something that's going to be the new norm. And Jim, if I knew what that was going to be, I think I could make a lot of money right now. But
yeah.
I don't know what it is, other than at Circle, we are going to continue to live up to our mission. That's one thing. Our patients come first in everything that we do. And we made a promise to you a few years back to deliver on something that we call complete connected care. You'll see us standing up to that over the summer.
Okay. Well, Jody White, President and CEO of Circle Health, Lowell General Hospital, I can't thank you enough for your leadership, for your work, for your coordination. We've just been such a great team together, the legislative delegation and all the stakeholders in this region. And I really appreciate you getting through this with us and helping us along the way. So I really appreciate you coming in today.
Representative, thanks for standing with us. I super appreciate it.
Well, thank you to everybody back at home. I look forward to our conversation next week when I talk to stakeholders and individuals on the front line fighting COVID-19 and helping people each and every day. So for myself, State Representative Jim Arciero, and my Zoom program. I look forward to seeing you next time. Thank you.